Hi, I'm Dr. Kharrazian. I want to talk to you about the thyroid blood sugar axis, and this is very important when it comes to Hashimoto's hypothyroidism. One of the most common overlooked triggers for Hashimoto's is dysglycemia. Dysglycemia being either hypoglycemia or insulin resistance. So one of the things that we know is that when an individual becomes hypoglycemic, then they get shaky, lightheaded, and irritable throughout the day, that there's a shift in something called IL-6, and IL-6 activates an immune response called T helper 17, the Th17 response, and that promotes the autoimmune reactivity. So when it comes to Hashimoto's patients, it's really critical to make sure that they learn how to stabilize their blood sugars and to avoid blood sugar drops. We also know that insulin, and people that have insulin resistance have increased risk for flaring up their Hashimoto's autoimmune response. Insulin will aggravate the inflammatory cascade through NF-kappa B and then trigger also this Th17 pathway and then promote the autoimmune response. Now, people that have insulin resistance usually get really tired after they eat. So when we see patients that have Hashimoto's hypothyroidism and they get shaky, lightheaded, irritable, or get fatigued after they eat, or maybe a combination of both, we know until we control their blood sugar stability, we're going to have a very hard time managing their Hashimoto's. Now, on top of all that, when people have Hashimoto's, their states of physiology in which their thyroid hormones are high or they're low, or sometimes they're just actually hypothyroid altogether because they've had some significant degree of follicular cell destruction. And when there's lack of thyroid hormones in the body, then several things also happen. Insulin degrades much slower, so it's easier to become insulin resistant. There is reduced glucose uptake by the gut, so it's easier to be hypoglycemic. And these vicious cycles back and forth can really create a very difficult pattern for a patient with Hashimoto's to really control their autoimmune response. So even though there's been a lot of focus on gluten and pathogens and various factors to support Hashimoto's, one of the most overlooked mechanism is how dysglycemia impacts the activity and flare-up of people suffering from Hashimoto's. So we'll be going over all these and many more clinical concepts in the Kharrazian Institute course, Hashimoto's Clinical Strategy and Treatment Applications, and I hope you can attend. Thank you for your attention.